Good evening, friends. I will start with today's session. We are discussing regarding the homeopathic management of local diseases since last 2-3 lectures. Hahnemann have given maximum time to explain all those things because he has cleared the concepts regarding the homeopathic management of local diseases. And while explaining that, at the start only he has explained that there are two varieties, either caused because of external causes or either caused because of some internal dynamic causes. If they are because of external causes, the line of treatment he has mentioned, first important thing is auxiliary measures followed by surgical intervention. And if the dynamic effect is there, homeopathic simillimum is the treatment. But while discussing the local disease due to the internal cause, he has explained many things. In old school, local diseases are considered to be local, and that's why it is quite easily treated with the local applications. The disease never vanishes or never disappears permanently. Or if it disappears, it enters somewhere inside, causing a suppression leading towards the most vital organs and affecting the health of the human being. And this concept he wants to remove from your mind. And that's why he has explained all the details how to manage all those cases. So he explained over there many times these patients comes to you after a lot of allopathic medicines consumed, and they comes with local disease with very few symptoms, and then it becomes rather difficult to treat. In such types of cases, the present totality, along with you have to ask the past history, how exactly disease has been started, and to start with how the presentation was, to consider that history, and that makes the true totality and find it out the remedy on the basis of that. And this is the way with which one can approach to treat those diseases. He explains over there they are not the local diseases only, they are the part and parcel of the whole human being, and because of which they are appearing on the local part. So you have to treat the whole individual for that purpose. Many a times it happens that some patients comes to you with acute local disease, and you find it out that it might be acute and you treat it locally, and it never disappears. If it disappears, it enters inside. But sometimes it happens that the patient comes to you for homeopathic treatment, you find it out acute totality, you prescribe remedy, and it disappears, but some remnant still remains. And if those remains, anyone explains they are because of the soric miasm in background. During Hahnemannian time, they are definitely the soric background. Nowadays, it is mixed miasmatic traits are more common, but miasm is always behind. And because of that mixed miasm, because of the sora, the because of the chronic miasm behind, those still remains. And then Hahnemann explains, if you want to treat them, you have to find it out, a right anti-miasmatic remedy, or according to him, if the sora is the cause, the right antisoric remedy. And that you have to give internally, not externally. And he is very firm regarding it that one should not use it in the local manner. There were people who used to tell that the same remedy should be given internally at the same time externally. Hahnemann denies this, and that's what we have learned in yesterday's lecture. That he explains over there that no such treatment is admissible in homeopathy. That same medicine should be given locally as well as internally. Because if you remove the symptoms of the case without treating the internal cause, internal derangement of vital force, the patient will ruin his health. And for that purpose, he says there is no need to give or apply that locally and just give the medicine internally. So we have finished up to the 197. Today we have to start with the 198. So before that, there was a short note, one sentence was there, just 114. Recent each eruption, Shankri, Kondelmata, as I have indicated in my book on chronic diseases. These are all three primary symptoms of three miasms. Each eruption is the primary manifestation of sora. Shankar is the primary manifestation of syphilis, and condylomata is the primary manifestation of psychotic miasm. and all they appears on the skin on the external most part. And if you remove them in externally, they causes damage to the human being. So they should be treated only and only with the internal treatment. And now he turns to explain 198 what he says. The mere topical employment of the medicines that are powerful for cure when given internally to the local symptoms of chronic miasmatic diseases is for the same reason quite inadmissible. For if the local affection of the chronic disease be only removed locally and in one-sided manner, the internal treatment indispensable for the complete restoration of health remains dubious. Dubious म्हणजे अनिश्चित. Remains in dubious obscurity. Obscurity, अस्पष्ट. The chief symptom, the local affection is gone, and there remains only the other, less distinguishable symptoms, which are less constant and less persistent than the local affection, and frequently not sufficiently peculiar or too slightly characteristic to display after that a picture of disease in a clear, peculiar outlines. See what he wants to say. In chronic miasmatic disease, if you try to remove their primary manifestations with local treatment, generally what happens? Temporarily, there might be a palliation. It disappears and reappears. And when you do it again and again, when they comes again, at that time they loses the symptoms. What remains is the just a visible manifestation or visible pathology. Those visible pathologies or visible symptoms, if they don't carry the symptomatology, doesn't give exactly the remedy. So it becomes obscure. The case which was curable with the help of symptomatology now becomes incurable because you don't have the symptoms. We'll take simple example. A patient who is suffering from the chronic eczematous patch on his extremity, and he used to suffer a lot. He used to scratch a lot. There was a tremendous itching and burning, and he used to, whenever he used to get that severe attack, he used to keep it in warm water, and then he used to feel the better. So that was the symptomatology. So there was a symptom. The eczema is the visible sign, but it is itching. Itching is aggravated by scratching. It is followed by burning. Burning is better by keeping hand in warm water. Now, these modalities, these symptoms disappears if you apply local ointment. If you give a clobetasol ointment, a topical application. Yes, it disappears, patient feels better for a week or 15 days or 1 month. And he again comes and again comes with the same symptoms. But now it doesn't have a symptom. He says that, yes, doctor, there is eczema and this, it never looks good. Earlier, it used to itch a lot. Now it doesn't itch, but it never looks good. See, the symptom is lost. Now what remains is the pathology. Now what remains is the obscured picture of the disease, and which is very difficult to treat with the help of homeopathy if it doesn't carry a symptom. And this is what Hahnemann says. If you try any local ointment for the local disease or any topical application for the local disease, it removes the symptoms. And once it removes the symptoms, the disease becomes more difficult to cure because it becomes obscure. It becomes symptomless. And when it becomes symptomless, it is a rather difficult task to choose a remedy. For that purpose, he explains it is inadmissible. That means you don't apply any local application in chronic miasmatic diseases. So is it clear? So one should not make an experiment that same medicine should be given internally as well as externally. That experiment one should not do. And then he turns towards 199 and what he said, just see. If the remedy perfectly homeopathic to the diseases had not been discovered at the time when the local symptoms were destroyed by the corrosive or desiccative external remedy or by the knife, then the case becomes much more difficult on account of the too indefinite, uncharacteristic, and inconstant appearance of remaining symptoms. For what might have contributed most to determine the selection of the most suitable remedy and its internal employment until the disease should have been completely annihilated, and namely, the external principal symptom has been removed from our observation. So, what happens if you remove those symptoms by local things? The case becomes more difficult to solve because the remaining symptoms are uncharacteristic. The word which he has used is very clear, uncharacteristic. So they are not peculiar, they are not queer, they are not rare, they are not strange, they are not striking. And what they are the common symptoms. So if a patient comes to you, doctor, I have these eruptions, finished. What it causes? He says nothing, but it never looks good. That's all. You don't have a symptom to treat. How can you find it out a remedy? You diagnose, yes, this is eczema. You diagnose, this is psoriasis. You diagnose, this is lichen planus. But what is the use? On the basis of psoriasis, you cannot find it out a remedy. On the basis of lichen planus, you cannot find it out a remedy. Unless and until it has a symptoms, you cannot reach to the simile. And every patient in the primary level always presents with the symptoms more than the pathology. So even though the psoriasis when starts in earlier phase, it always has symptoms. Some patient comes to you and they say that there is a lot of itching, and then they say there is a lot of burning, and they say that they want to keep that in cold water. Some patient says no, they feel better by warm water. Some patient says that doctor, there is a lot of burning and itching. I want to scratch until it bleeds, and you observe there is a pus collected over there and there is thick scab over it. Every patient presents the symptomatology in a different manner. Everyone carries a different set of symptoms, and because of which it is very easy to find it out a remedy. But if you apply any local ointment to those eruptions at the primary level, the patient feels better. Patient is happy because it disappears for time being. If patient's health is good, it reappears. When it reappears, it loses this characteristicness. The earlier the eruption was there, that eruptions were thick, scaly eruptions, thick scab under which the pus was collected and it is oozing from sides and patient is scratching over there. It is very easy to find it out a remedy. So what is the remedy? Anyone? Simple.
Arsenic. Arsenic.
No arsenic. Very simple. Patient comes with eruptions, thick scabs under which the pus is collected and it oozing from sides. Yes, Kirtika, very correct. Meserium. It is meserium. So if it is meserium, how do you come to the meserium? Not on the diagnosis. You never come to the meserium on the basis of diagnosis. You came to the conclusion on the basis of the characteristic of meserium. But if you give antibiotic to this patient, local antibiotic, local steroid, that disappears, and when it reappears, now there is only eczema. There is no specific characteristic symptom. There is nothing. He says this never looks good. Now the case has become difficult. It has spoiled. It has spoiled its symptoms, which were primarily very important. And this is the problem which happens when you treat such things locally. And recurrence is the rule if the patient's vigor is good. If patient's vigor is bad, it enters inside, causing new pathologies inside. So see, these thing one must understand, and for that purpose, he says that one should not go for local application. And it is inadmissible in homeopathy. There is one more footnote, what here he was explaining over there, 115, as was the case before my time with the remedies for the condylomatous disease and the antisodic medicine. So even today, if the condylomata is there, what is there? What is the treatment in allopathy? They do cautery, they remove it surgically. Those were the treatments which were available. And once you remove them with cautery, with the help of surgery, you remove the symptoms. You what remains over there are the obscured symptoms with which it is very difficult to reach to the remedy. For that purpose, Hahnemann says you should not treat them locally. We'll turn towards the one more aphorism number 200. So we are reaching to 2nd century. Had it still been present to guide the internal treatment, the homeopathic remedy for the whole disease might have been discovered, and had that time found the persistence of the local affection during its internal employment would have shown that the cure was not yet completed, but where it cured on its seat, this would be convincing proof that the disease was completely eradicated and the desired recovery from the entire disease was fully accomplished. An inestimable, indispensable advantage to reach to the perfect cure. And now he explains what to do in such types of cases. So if a patient who is brought to you for the homeopathic treatment, for example, a case of psoriasis, and he comes to you, you take his whole case, you find it out, the symptomatology, the local symptomatology, then you understand that individual, considering that patient as a whole, and you reach to the right remedy. And you have given that right remedy only internally. You have not applied any local ointment. So, if your remedy is working, if patient comes for follow, he shows you, yes, doctor, this much has been cured, this much has changed, or this has aggravated, this problem is not yet settled. He will going to explain about the things. That means that you have a very clear-cut indication on the basis of which you can understand whether internal disease is cured or not cured. It is very simple to understand on the basis of that. So symptoms are the indications of the internal dynamic derangement of the disease. And once you understand them properly, then it becomes a very simple task to find it out right remedy. And then you can understand whether the internal dynamic derangement is cured or not. But if you remove those symptoms just locally, it is vanishing. You never understand whether internal disease is cured. And if it is not possible to understand, then that internal stigma can affect the internal organs more and more strongly and can produce internal damage also. So one should not remove the local symptoms by local means so that those are the indications with which we can understand whether its internal dynamic derangement is getting cured or not. So he was very clear about its explanation that how one should go with those manifestations of local diseases or how one should treat local diseases with internal treatment only. So keep it in your mind. Chronic local diseases or one-sided diseases should be treated internally and not by external means at all. I think we'll stop over here. We'll continue with the next aphorisms because still I few more which are very, very important regarding this concept which he mentioned over there. So tomorrow's session will continue with the aphorism number 201. So thank you being there. And my suggestion to all of you today, I'm going to I have kept the open session of question and answers for Thursday's Divine School session. So do join. And if you have any query regarding anything regarding, if there might be any queries regarding potency, regarding how to apply or what to do. All such, whatever the queries are there in your mind, you can come with those queries. We can discuss. But one should not come with cases. There are people who ask me answers, sir, what I should give to this case. This is not done. If you want to, you have a query in handling certain things regarding the potency, regarding the thinking, logic, or any query, you can discuss in that session. No direct case taking, no case, because which is not useful. Within half an hour, how I can explain you the remedy, because I have not seen that patient. So no such types of question, but question should be related with homeopathy, relate practical problems with the homeopathy which you get, and those we'll discuss in today's session. So it is an open session for all of you. Do join sharp at 9 o'clock. Thank you very much. Any query?
Hello, sir.
Hmm?
Yes, sir. One question for now. Sir, in skin conditions, if we want to give any nosode as an intercurrent to the patient, then which potency should we give 30 or 1 m? Because it is said generally nosodes are given in higher potencies.
Yes. If you are using it in as an intercurrent, then definitely high potency. If you are giving it as a similimum, you might start with low. But whatever it may be, whether you are using high or whether you are using low, it should not be repeated too much. They are strong, and that's why many a times they can create an aggravation if you unnecessarily repeat. So you should not repeat them. It depends upon situation whether to give low potency or high potency. If it is, it depends. Basically, it depends at that specific time. So if the patient is having good mentals, or you have selected that remedy only on the basis of miasm. For example, patient is having the tubercular miasm in background and you want to treat that with the help of tuberculin. Give a single dose of tuberculin 1 m. That's all. No, don't repeat it. So there is no need to repeat. But when you use the intercurrent, generally it should be high potency. Sir, should we
Okay, sir.
use
Thank you.
Sir, should we use Calendula Q locally in fungal infections or what case? In fungal infections, yes, definitely. Not for warts. Warts, it will not be useful at all. Fine. Anything else? Calendula Q dissolved in water should be applied. Otherwise, it produces little bit burning over there. So it should be dissolved in water, diluted in water. Okay. So we'll conclude today's session and we'll meet at 9 o'clock with some good questions and answers. It will be, in fact, very live session. Instead of monotonous, one-sided, it will be better application. So whatever may be the queries which happens to be there in your mind, you can put over there and we can have a chat. Thank you.